Demonized and suppressed by the war on drugs, psychedelic medicines are making their return, and we're here to bring you the latest in scientific research and therapeutic practices involving psychedelic medicines from psilocybin to ayahuasca to DMT and beyond. This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and this week we're going to be discussing meaning making in psychedelic healing with Dr. Ben Medrano. Dr. Medrano is the former Senior Vice President and U.S. Medical Director of Field Trip Health. He has extensive experience in the evolving field of integrated approaches. He has continued his efforts toward increasing access to ketamine therapies as the current co-medical director of New Life. He also continues to serve as medical director of Field Trip NYC and DC clinics while continuing his private practice. I love this conversation. Ben is a colleague of mine, and I am very honored to get to work with him. And I love this discussion we have. I mean, I think so many of us have psychedelic experiences, and we're like, what meaning should we make out of what we experienced? And so that's what we're going to be discussing today on the podcast. Just a reminder before we get started, the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And as always, if you, like Dr. Medrano, are a clinician of any sort, psychiatrist like he is, or a physician, primary care doctor, PA, nurse practitioner, therapist, social worker, and you want to learn more about psychedelic medicines and how they may benefit your patients, please check out the Psychedelic Medicine Association at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Ben.
Wonderful to be here.
I am very excited to have Ben on the podcast. Ben and I work together. We are co-medical directors at New Life Health, but more so than that, Ben is an outstanding human, one of my faves of all time. It's true, Ben. You're just like this calming, very wise gent that I'm very happy came along. We did not know each other before working together. We had not somehow crossed paths. True. So this is very true. So what I also love is that Ben is full of surprises. And so when I came to Ben, like, what topic shall we discuss on the podcast? Ben suggested we talk about meaning making, specifically, some of the meaning making that we may experience when we do journeys related to psychedelic healing. And I'm sure if you have gone through a psychedelic journey and you're listening to this podcast, you may instantly realize what we're talking about, because sometimes you see things in your journeys, or you experience things, or you get messages, and you may say, what do I make of this? What is this trying to show me or teach me? And what kind of, should I assign a meaning to this? And so, Ben, I'm actually very happy that we're going to be having this discussion, but let's take a little step back. And can you tell us a little bit about how you got into, you're a psychiatrist, how you got into the world of psychedelics?
Oh, before I jump in, I just want to say I am so excited to be chatting with you right now. So first of all, I'm a big fan. I've listened to most of your podcasts. I've learned a lot from your podcasts. And actually, I'm very honored just to be amongst the illustrious guests that you've had here. You've had a bunch of just amazing researchers and so on, and sort of consider myself a bit of an oddball as far as guests go, as people will learn. And so I'll just jump right in and tell you how I got here. And I feel like telling my story is not so much to say, me, which is a little strange to tell your own story, by the way, as somebody who's practiced Buddhism and their entire life. And the core concepts in Buddhism is that there is no self. So talking about yourself is sort of a strange dichotomy, an oxymoron. It shouldn't even be happening. And if anything, just beginning to talk about the self should just be a humbling experience, because it doesn't really exist from their perspective. So I will dive right in now. But before that, I'll say the reason why it's relevant is because to do this work is what brings the most meaning to my life. My life as a whole, its trajectory and coming here, I think for many of the people that you've interviewed, probably even for yourself, for so many people, including our patients, we're trying to connect with them on a level of making sense of everything that has occurred to them. I mean, when we think about how psychedelics are beneficial, we begin to think about trauma, first of all. And I think more and more we're beginning to appreciate that we are all experiencing traumas, various little traumas, insults throughout our lives that build up and become very complicated, and they shape who we are. And so I think telling our stories is part of this process of healing. So I have always been a bit of a spiritual person. And I grew up in a Baha'i family in a podunk town in Kansas. And I'm of mixed ethnicity. My father's Latino, he's Mexican, and my mother is sort of I would just say a Midwestern mutt, a beautiful mutt at that, but European in that sense. And so growing up in a small town in Kansas of mixed ethnicity, a Baha'i is already a bit of a weird start, as there weren't a lot of Baha'is there, and there weren't a lot of mixed kids in the town that I was in. I learned very quickly that it's best to not be perceived as Mexican, as my father taught me at that time. And I also learned to not really get into it with kids about the idea that there is no Santa Claus. And so in trying to make sense of being different, I also dealt with being bullied, and so got into uh, many fights as a kid. Had to learn how to stick up for myself, uh, but also in the midst of that, I went through a lot with my family, and I'm pretty open about this. Many of my family members have suffered from mental illness. Within my family, you will find the whole DSM of PTSD, major depressive disorder, substance use disorders, um, and and suicides and overdoses. So I've lost many family members, and I've lost many family members who are still alive, to some extent, to substances. And I'm happy to say that many of them are recuperating their lives. But nonetheless, a big part of my life was bearing witness and being impacted by these at a very early age, in the midst of being different and poor in a small town in Kansas. Now, for me, immediately, I began to realize that, how do I make sense of all this suffering? I think that's sort of what a lot of people who come to me are feeling. They're like, well, I'm hoping to make sense of this. A lot of the times people are just wanting to, get away from it. But for me, it became very clear that I needed to wrap my mind around why this was happening. Why me? That's what we always think. And so spirituality became a big part of how I might be able to make sense of that. So as a kid, I would learn a lot of prayers. I memorized a lot of prayers and recite them. I loved prayers. It was just a weird thing. um, and then when I got into my teens, I was asked, at 16, Baha'is are youth are asked to choose whether or not they're Baha'is. So it's not imposed on them. And by the time I got to 16, I had known enough about the Baha'i faith that, one, to be a good Baha'i, you can't have sex until you're married. Two, you can't have drugs or alcohol. And so the writing was on the wall for me that by the time I was 16, I don't think I'm a Baha'i, much to the dissatisfaction of my mother, who has since come back around on this point. But what really pulled me into this realm of exploration of the human experience, i.e., altered states of mind and sex, was not just puberty, but was the fact that I moved to Chicago at that time, and I had gotten connected with the rave scene. And this is in the early 90s in Chicago. And for those who are familiar with this scene, was a very busy scene. That's when house music was basically being born. And most of the DJs that I grew up listening to in abandoned warehouses every weekend for 4 to 5 years of my life are now world-class DJs. And I actually know some of them. Well, sort of little name
Humble
drop
brag
sort of.
thrown in there.
I was an aspiring DJ myself. I think things have changed, and now I'm a terrible DJ because I can't understand the equipment. But anyways, that is where I got my introduction to the sacraments, to medicines, and and I began to get a sense of the power of not just psychedelics, but of my own mind and of community, connection, music. Uh, I think the rave scene, for better or for worse, although I saw a lot and experienced a lot of hardships of the dangers of unregulated or unsupported use of psychedelics, I also saw a lot of positives to that. For me, it was a beginning of me finding joy, seeing that joy was possible with my first dose of MDMA, and to also see that that consciousness is much more than we can even understand at this point, and that consciousness has a lot of power. And so that's when we get into this topic of meaning making. Now, just getting your mind blown by a psychedelic substance is not going to fix things. That's something I had to learn real quick. And when I started to actually see friends, really, I lost a few friends actually to drug overdoses during this time, and I started to see that this is a dangerous situation, and I began to reflect on, well, where is it? What is going to help me bring meaning and direction and structure to my life? And I began to meditate. This is again during my teens. I then uh, started to wonder, well, who knows how to meditate best? How should I learn how to meditate? And I realized the Buddhists have been doing this for centuries. And so I started reading some Buddhist teachings on meditation. Long story short, I ended up getting involved in a Tibetan Buddhist community in my teens. I took Buddhist vows by the time I was 19. And by the time I was 21, I had shipped myself off to Buddhist seminary. And so I spent for about 15 years afterwards, with breaks here and there for med school and college and all that, I spent much of my time studying and practicing Buddhism and in the Tibetan Buddhist community. In fact, I actually became very close with my guru. And my guru actually asked me to be his right-hand man and travel with him. And so I spent a couple of years traveling with a teacher of this large Buddhist community, went to Tibet, went to India, and really got to see another side of a perspective of the world and how other people make meaning. I realized I couldn't pay the bills as a Buddhist practitioner. At some point, I talked to my guru and I told him, I was thinking of becoming a monk, and he said to me, "The world has enough monks. We need more people in the world." And so that's when I started to figure out my career. And I decided the best way I could implement all of these things that I just shared with you is through mental health. And so I went down the road of first, I wanted to become a therapist. I studied in Europa University for a while to be a contemplative therapist, and soon found that I needed to do some more hard sciences. So I switched over to University of Colorado, and I went there for undergrad for biology, went on to University of Colorado School of Medicine, and then went to do my residency in psychiatry at Mount Sinai Hospitals at the Beth Israel site. After that, I decided to go into community psychiatry because I was I had a kinship to working with diverse populations based on my background. And I decided to go into community psych to work in assertive community treatment. So that's called ACT team for short. And that's really going into the trenches of mental health. So I spent a couple of years in East Harlem looking for my patients in NYCHA housing, in public housing, and finding them to make sure, one, they're alive, two, if they're taking their meds, and three, if they're not, that I give them to them so that I can try to keep them out of the hospital. And spending that time working with the most traumatized of populations and really getting to know them on a personal level, caring for them one-on-one, and just seeing the world around them, seeing the setting in which they reside, seeing the sports or lack thereof in their lives, really opened my eyes to, again, the power of consciousness, the power of setting, and the power of compassion and the need to really address root causes rather than just constantly putting a band-aid of all these different medications that I, really find have a lot of utility in certain conditions, but can also really set people back. And so I had to really ask myself, what do I want to do with my career? Is this where I'm best placed? And so again, always thinking of my life from this perspective of, how do I make meaning of everything that I've been through and everything that I've learned? That's when I began to come back to the topic of psychedelics in the literature and also in practice via ketamine assisted therapy. So sorry for a long monologue, but I wanted to just start just to give a sense of, what inspires me, why I'm here, and hand it back to you.
I very much appreciate you sharing your story because I did not know, I did not know your story, Ben. So that was a delight for me to learn more about you. And also to point out that this is now the second episode that we are going to release in a row with a psychiatrist named Ben, who is a former raver. This is a very
That's right.
strange pattern that is developing. This one will not have a drum duet at the end, but maybe we can work something else out. But I thought that was hilarious. Had no idea you were also a former raver. This is such an interesting track. And I just am struck by how much that you put into that community work that you did. And this is where, I'm going to get in my very tiny soapbox, but, a lot of times we make absolutes, and people in the psychedelic world, we make absolutes like no doctor is paying attention to psychedelics, or they only care about handing out antidepressants. And there are people like you who have always cared from the beginning and have been open to new things. And it's more just an issue of education. You, from your diverse experiences, have exposure to things maybe other people hadn't yet had exposure to, right? And so, just having remembering to have that compassion. Your provider might not be trying to actively keep psychedelics from you, they may just not know about it. But there are many psychiatrists, physicians, etc., healthcare workers that do really want the best for their patients at all costs. You're going into those communities one-on-one, seeing patients. So thank you for everything that you've done, bringing us to this point where we get to work together. So I love how you touched on the amount of times that you were like trying to make meaning of the different experiences you were going through and working your background into it. Let's talk a little bit about how that may translate to somebody who has a psychedelic experience. And what I think is going to be kind of interesting for this talk is that the bulk, I believe, of your psychedelic experience professionally is in ketamine, which, at least in my personal experience, it's a shorter experience. But for me, that was actually the one I had in fact, I'll just be honest, I couldn't ever make meaning out of it. I've done it twice. Lots of things that I saw was completely it's the one time where I thought, I wish somebody would come by and make some meaning out of this for it. Like ayahuasca gives me very clear messages. So does psilocybin. Ketamine was a little bit confusing. So if you could just like start the conversation by, as a psychiatrist, I'm sure you've seen people come back to you after they've had a journey, they're working on integration, et cetera, and they might bring things up. Where does one start in evaluating how to make meaning of what they might have experienced?
Yeah, well, I feel like one has to take a step back first and understand themselves and how they're even approaching the conversation. And I think, not to get on a soapbox here, because I think it's unreasonable to ask that every therapist and provider have really sort of processed all their own stuff. I mean, I'm still processing my own stuff. So, like, who am I to say? But I think for us to do this work, we all need to actually really have a good sense of who we are and how we're approaching the conversation. Because I think many of us that work in this field know that our patients in mental health have, pardon my French, a really good bullshit meter. And that can immediately turn them off to ability to even, be assisted by an individual who's trying to offer this kind of setting and support. So I guess what I'm getting at is be authentic in your work and know where your compassion comes from. And frankly, one needs to have empathy for oneself, some compassion for themselves to be able to truly provide it for others. And so that actually does mean doing a little bit of your own work. And you hear a lot of people say that. But but to go back to your question, and actually, sorry, I got off maybe if you could rephrase it for me.
Sure. Where can people start if they are looking to make some meaning out of
Hmm.
perhaps a confusing experience that did not clearly illustrate what it was trying to get across?
Yeah. Oh, to go back to your example, yeah, that's something I do hear a lot. Ketamine is a very interesting medicine because it does. I sometimes call it the great imitator because it will sometimes imitate other medicines. Like sometimes it'll be very empathogenic, like MDMA. Other times it'll be very visionary, like you were sort of mentioning ayahuasca and your experiences with that. And then other times it'll just be sort of spacey, like a little bit like a deep meditative experience. From my perspective of ketamine is to just acknowledge its weirdness to begin with and know that you can't have any particular expectations of how it's going to go, and to do your best to not drive that or sort of prime that in other people as well. uh, I sometimes worry that the conversation around ketamine is that we've sort of, you'll hear the popular conversation as this is the psychedelic that we use because, and this is sort of a misnomer, but it's the only legal psychedelic. Uh, and they'll say it's a misnomer because it's actually not a 5-HT2A agonist. It's an MDAR uh, blocker. So uh, I think all of that aside, what I'm encouraging is a sense of openness and not priming. And if you approach that, you tend to have better outcomes, has just been my experience in terms of the conversations. But that being said, how does one make use of it? It means that you need to actually understand your patient's frame or your client, however you want to phrase it. You need to understand their sense of what reality is to them. What are their beliefs? Like, where did they come from culturally? Uh, it's not just doing an analytic sort of background check on what was your relationship with your parents, or do you have any traumas. It's really getting into the broader perspective of how do they perceive the world and themselves, and how do they perceive this experience, which is sort of what I was getting into, and their relationship to this particular medicine. Like there's a lot to sort of hold there as the foundation for beginning to make meaning. It means you need to really understand who this person is, and if you don't, to at least try to elicit it so that they can get a better understanding of themselves in the process. Because as they begin to get that sense of, oh, I guess I do see the world or myself this way, then they have something to work with. I think it's foundational to work on the level of perception and consciousness of self and other. And that's where a lot of my own sort of understanding of Buddhism has really been helpful for me, because that's really all they think about is what is consciousness, what is self, what is other. And I'm not sitting here just saying yay Buddhism. I mean, a lot of philosophies and religions think this way. So whatever's true to you that you could bring into the conversation like that, I encourage.
Yeah, and I think that so you've brought up an interesting point in how you're phrasing it, maybe from the therapist, like finding out about the patient, who the patient perceives themselves to be, and it occurred to me, I was like, well, what about the person who's trying to meaning make for themselves? And then I get back to, well, that is one thing to do, but also, as I think I've said probably 1 million times on the podcast, always beneficial to have somebody to work with you on integration, right? I think
Mm-hmm.
they've shown that the number one thing that makes integration more successful than not is therapy. So if you say like I'm doing
Yeah.
integration, I'm doing yoga every day and I'm journaling, that may have some benefits, absolutely, but research has shown, at least the minimal research that exists, that the therapeutic component, having somebody to discuss things with, is very beneficial. So while you may be trying to make meaning for yourself, if that is not working, perhaps seek out an integration specialist that can help you with that. And I think you made a good point
Good.
before, is that we are from a very large field of different mental health disciplines, and not all of them are going to be trained in this specific type of meaning making. And so you might have a great therapist, but they may not be familiar with altered states of conscience, etc. So perhaps this is when you might employ a second person, somebody who does specifically have some experience in evaluating and helping you make meaning, and going through the steps that you're talking about. So thank you for bringing that up. So now that somebody's got a foundation of maybe who they are, the therapist has helped them kind of dig out what they've learned. What I know, and this is such a hard conversation because everything is so, everybody's journeys are so different. It's hard to say like, what's step two, right? But if there is a step two, or if there's like a place to go from there, where might that be?
Yeah, so we've talked a little bit about, I guess, really just a basic approach and attitude and how to prepare people for it, or more so what not to do, which has to do with preparing yourself and trying not to prime people. We can get into some of the tangibles of what's being done in practice, and I fear being a little bit redundant in talking about setting, because I feel like it comes up in all of your podcasts, and most of your listeners are probably very familiar with set and setting at this point. But maybe if we can just briefly touch on it. So mindset. So we talked a little bit about the mindset going in when we say try not to prime, try to understand where people are coming from, how they make meaning, setting intentions, or setting some sense of why am I doing this particular session? What do I want to get out of it? And now when we go into setting, the physical setting, but also the societal or cultural setting that people are in, even just the climate of the world, all of these things play a role in setting. They need to be included in one's thought process. Now, so now we got sort of the basics out of the way. When we start to look at how we can use these two platforms of set and setting, some particulars that I see being done, and sort of done in some of the clinics and practices that I work with, is bringing in sort of ceremony light, so to speak. Try to whatever's true to you as the person who's supporting someone on a journey, to create an opportunity to bring some more importance to the experience, rather than just saying, I'm going to give you this drug, sit down here, relax, I'll be nearby. That we're going to say, well, what rings true to you? Do you have, like, for example, do you have an object that is meaningful to you? Can you bring that in? Sometimes some people call this an altar object, or some kind of sacred object to that individual that they can bring into their session. And in terms of what kind of ceremony, it's really what I do when I'm working with people is, once I get a sense of what their beliefs or their philosophies or what they're comfortable with, then we may come up with a ceremony together, like how to open the ceremony. Oftentimes, if I get a sense that it's not too triggering or traumatic, I will suggest that we honor those people who have been important to us in our lives, like remembering our mother and father, or our mentors, or say somebody is Christian, and so inviting Jesus into the experience, or Buddha, or any kind of a spiritual figure that we found inspiring, or for some people it might be a leader or a philosopher. Trying to really invite in a sense of inspiration, energy, and support is really the goal of what, or part of the goal of what ceremony is. Now, another part of it is just sort of keeping things contained. In groups, you'll see people pass a sort of a talking staff, and so having some ritual to say, I'm going to listen and honor your words right now. And even when I'm working with people one-on-one, I make a point to let them know this is the time to share. I will just be listening, and just making it very clear so that they know it's not necessarily an exchange. It's an opportunity for them to reflect openly, so that they don't have to worry about what I'm thinking or how I'm going to respond to them. Some people like to say prayers. Some people want to meditate. All these things I invite in. But these are just some examples of how ceremony and meaning making tools that we see utilized. Another element during, so most of what I said is sort of before the experience. During the experience, it's for a lot of people, it's encouraging them to stay on their, sometimes I'll call it stay on your spirit canoe, or stay on your mat. Try not to get up and do other things. You're here to do it deep inner work. So having that sense of structure and ceremony to that. And then maybe I'll take a pause and see if you have other questions based off of anything I just said there.
No, but it brought up a thought to me, because a lot of what I was thinking about in meaning making was post ceremony. But it occurred to me that, you have experience in ketamine assisted psychotherapy, which is one of the times that you have the ability to be with somebody while they're experiencing the thing that may be confusing to them, that they may want to make meaning of in real time. Right? Like, I'm seeing this thing, I'm
Absolutely.
experiencing this, so just at some point, before I forgot to ask you about that, I'd love if you could work in what it is like, like you said, stay on your mat, stay in your spirit canoe. But if they're, strolling around in their spirit canoe, and then this thing comes up, and, they've got a therapist there with them, and they're, I'm assuming that the therapist's job is to not ascribe a meaning to it right then and there. But what kinds of things do you do when that situation arises?
Yeah, well, this try not to make this a bigger conversation than it needs to be, because this is sort of medicine dependent and dose dependent, and also it's contextually dependent. Like, is this individual, is it couples, or is it groups? So I'll put it in the frame of an individual, and we'll say that this is for somebody who's doing higher doses, like a psychedelic dose of something. So in that context, really your role as a guide is honoring and affirming the experience. It's as simple as that, and being supportive. So having a dialogue is not necessarily encouraged in higher doses, but letting them know that you hear them. And sometimes it's as simple as, aha, I hear you. Or really just making gestures of, really letting them know that you're with them, and not just like, oh, okay, but not saying just okay, but like really feeling the words that they're saying and reflecting that back to them. Um, I really avoid and recommend that people avoid like diving into that. Say, oh, what do you think that means? that's not that's not usually not encouraged. However, I have a dear friend and colleague, Dr. Gita Vade, who works with low dose ketamine, and she has amazing outcomes in working with low doses on a relational level. And she's bringing in all of her years of training and analytic training, and having a dialogue with them. So at lower doses, one could argue in the opposite direction, like we should dive into that. And that's another route towards meaning making, actually having relational therapy. But at the psychedelic doses, it's more what I just said.
That makes complete sense. And it also occurred to me, these are, sorry, the random thoughts that are occurring to me while we talk about this, is that what comes out of a psychedelic journey, because it probably has a lot of analogy to when somebody comes to you for a dream interpretation, right? Like, this is a same example. Like, I spent an hour last night seeing something, I don't know what it meant. How do I, first off, do you need to make a sense of a dream? Maybe, maybe not. But generally, when we do a psychedelic, it's because we want to benefit on both levels. So, like I said, when I had done my ketamine, whether or not I understood the meaning making or whatever it was trying to show me, I experienced the physiologic benefits from the ketamine, what it does to you cellularly, etc. But I think most people want those physiologic benefits, and would love that if there was something to be gleaned from what they saw, that they can actually figure that out too. So, say somebody, like they've done the experience, they've, you've set it up ceremonially, and they've stayed in their spirit canoe and all those things, and they've done the work, and then afterward they've, got this kind of picture or set of messages, and then, like you said, that we've worked through the guide, figuring out where they come from. And do you ask, like, what meaning do you subscribe to it? Do you kind of ask the person like what their initial, first blush thought was, why they saw this?
Yeah. I can't help but think, Lynn Marie, I'm curious what your experiences have been as you went through ketamine, having shared a little bit with me already, that you're, in some ways, would you say you're still just like trying to figure out what was that about?
I mean, for both of them, yes. And
Yeah.
100%. And I have yet, and full disclosure, neither of them did I have an integration therapist afterward to work with. The you know, in my work, people will be like, here, come to this ceremony or whatever. But very few of them, and I'm going to be very upfront about this. This is why I constantly stress the importance of getting an integration person, because I know I've received the same messages time after time, because I have not properly integrated them, or that integration has not made it to me on a somatic level. I might understand it conceptually, but still my nervous system hasn't gotten the message. So like, I want to be like the cautionary tale, not that I'm like unraveling or something, but like, I'm sure I could have made a lot more out of my journeys had I had proper integration. So that's why I stress it a lot.
Hmm.
So yes, someday offline, I will tell you what I saw, and you feel free to make
Hmm.
some meaning out
Oh,
of it.
okay. I'm looking forward to hearing that. So, so there's, I think I'll just say with the disclaimer that I don't know all the right ways to integrate, and so what I'm sharing is just what I've learned, and we have a lot of talented therapists out there who are really, and not just therapists, but if we just go back into indigenous communities, and you can see some very creative, beautiful ways to integrate. Integration can happen, again, since the topic here is where we're talking about spirituality. Integration can really be stimulated by ceremony itself. And so, for example, actually, again, saying your intention and a closing prayer and doing possibly some physical movements or yoga or some meditation might actually bring light to those things that experience just on their own. Uh, Now, when we start to get into therapeutic modalities, the practice really is to let the inner healing intelligence be the guide. And so that means really the therapist needs to get out of the way of the process, and they're just there to reflect back, to provoke in the good sense, to try to bring out, elicit those images that people quickly forget a lot of the times, get them to be honored, like we were saying, even in the experience, we continue to honor and create the opportunity to unpack or to maybe even re experience and reflect from the less altered state of mind. So, for example, if somebody says, with ketamine experience, sometimes it could just be really dark because for a lot of people, they don't have as many sort of visual stimuli. And they're wearing the eye mask, and for some people they don't see, say, sacred geometry or those kinds of things. They'll just say it was really dark. um, there a lot of the times within the darkness there is a feeling, and so it's beginning to rather than to let people just write off their experience of I didn't see anything, uh, to to actually ask them, well, then reflect back what you're hearing. When I hear people say it's dark, they're usually saying it in a certain way. It was dark. That was so dark. And as they say that, I say, there's a sense of, it feels like a heavy sense to the way you're saying that. What are you feeling as you reflect on this darkness? And so you're just continuing to not let them just stop there. And a lot of the times you'll be surprised where it takes you. The darkness might be found within a certain pain within their body, and then you go into that pain, and there might be a memory affiliated with that pain. And so then you go into that pain, and then you begin to process it a little bit more, either in their history or in their life right now. And so it's basically the process of integration is to not let anything that comes into the experience not be honored or seen in some way, to allow it to be explored. And of course, not to push too much. You need to know when it's like, okay, this, they don't want to talk about this, or this really just, despite my best efforts, this doesn't seem to actually be something worth exploring. So you got to know the cues, but nonetheless, that's my approach, and that's how I've seen many therapists approach it.
Very cool. Thank you for sharing with that. And it brings back to me that I know you had mentioned when setting up, prior to the ceremony, you ask individuals if there's like a spiritual aspect that they'd like to bring in. Do you want to call in Jesus or Buddha or whomever else? Is that something that you weave back into the post experience, perhaps meaning making portion?
Mm. Well, and this is where having a altar object or some kind of sacred journey object or totem, whatever you want to call it, is helpful because people got to retrieve it. They got to bring it back with them at some point. And when people bring these objects, we ask them, well, what does this mean to you? At the beginning, and then we ask them to say that again on their way out the door. So like they say, and I retrieve this picture of my mother when she was younger, and it reminds me of. Now, when you say that after the experience you just had, sometimes there's an aha. You're like, oh yeah, now I really feel the sense of what my mother was going through at that time, and or simply the ceremony of stating your intention again at the end. Uh, I've always seen that more often than not be another aha moment for people and say, oh, my intention uh, was to explore this particular pain, and then they find that they explored it, maybe not in the ways that they had expected, but that's indeed what happened. So, having these sort of structures in place can be very, they're just cues, really, cues for consciousness to start to see things from angles that they don't normally see. Or again,
Uh,
saying a prayer,
yeah.
something like that.
I and I feel so sorry that like I'm randomly thinking of so many things that are just not necessarily they're like non sequiturs. But this is harkening back to the episode we did with Christopher Timmerman on psychedelic apprenticeship, where we talked a lot about what to do with what people bring to you afterward. You know, I saw my mother. I think the example that had come up in their research was like somebody had seen their mother suffocate them with a pillow, and like, what do they do with that afterward? Did that happen?
Oh,
What does that mean for their relationship with their mother if it did or didn't? I think the mother had passed away.
yeah.
What happens, you know, if there's any kind of general guidelines, if somebody's vision or what they saw is something that may be, you know, less on the confusing side and more on the disturbing side?
Yeah. Yeah, well, that example is sadly is one that we hear often. Reliving of trauma is a commonplace for this work, which is why it actually is healing, if held appropriately. So, how does one make meaning out of difficult circumstances that may be recovered? Is what I hear you asking.
Yes.
Hmm. Yeah, there's no one right way. And this is where we really get into just trauma therapy in general and shifting our frame away from just feeling like it needs to be one way of talking our way through it with our clients. You know, for anybody who hasn't read Bessel van der Kolk's The Body Keeps the Score, I feel like it is a requirement for anybody who wants to do not just trauma work, but to do this work, because you get a very good sense of all the different modalities that have been studied and their utility for different kinds of people. And for the most part, many of those processes are physical. And so I tend to, physical or creative is another way to say it. So utilizing art, utilizing music, um, utilizing theater, uh, utilizing dance. These are all sort of ways that people can begin to sort of process these feelings that come along with these memories. And really, it's just a matter of, again, knowing your client, knowing what it is they connect with, what they're comfortable with, what inspires them. And the same goes with all the other sort of integrative modalities that we're feeling increasingly confident about, use of yoga, somatic processings of all kinds of sorts, meditation, breath work. I think all of those are things that we need to be considered as part of the integration process, and that we shouldn't just think, oh, do more therapy. Uh, the integration is bigger than that. And of course, we hear a lot of people say journaling, that I'd argue that is a creative process as well. Uh, Another thought that comes to mind is really shifting the perspective away from the sort of goal oriented mindset that people come into. And I'm not just saying for people who are saying, oh, I want to change my mind with psychedelics, and it didn't change my mind, tends to be like some of the frustrations I hear when it doesn't necessarily deliver on the promise. But to sort of help people with that thought process and steer them more towards the sense of the path is the goal. The path of healing is where we're focused. That it would be nice, yes, I would, if I and all the people who do this work had the means to instantly cure people, we wouldn't be holding back. But what more and more, what I'm finding that we need to be empowered to do is to uh, is to bring people to the idea that the path of healing is exactly where we need to be, that it is actually the process. And then when people reside in that path more and get less focus on the goal, they tend to grow more, they tend to heal more.
Thank you for that. What in the meaning making realm, if anything, I mean, I'm sure there are things, have I not asked you about that you would love to share some things on?
Hmm.
You could also say, Lynn Marie, you've
Yeah,
asked me
yeah,
every
yeah.
last question, but
Gosh, as you can tell,
but I
I
know
could
I
go
have.
on and on about this. This is like my all-time favorite topic, and we could do a part two. No,
We can do a part two. Then we work together. I'll be like, let's just go meet. And
well, I think I started to get into it a little bit, and that is this idea of understanding our life narrative and starting to view the process of healing as a path more. I think that's really the thing that I want to emphasize the most. Like, what if when we bring people in, we invite people to start thinking about the things that inspire them, the things that bring joy in their life, and the perspectives that they hold around these things, as well as the perspectives of their pain, and begin to see if there's a path towards greater understanding of the pain and all of it. Like, uh, and that means helping people sort of find what makes the most sense to them, to find a sense of, you know, of inspiration, and to see if there's a way that they can carve their own path towards it in the process of appreciating the actual healing that's taking place in the moment. And that's why I think our narratives are so powerful, like really saying, how did I get to this point in my life, to this place, to this time, to this moment? So really, that's probably my sort of last thought. There's probably more I could say, but that's what I feel most passionate in this moment.
but we'll part two it. We
All
will
right.
definitely come back because you're right. We could talk absolutely forever. And now, so I'm going to go through and do our the ketamine that we offer, right? And so that I will
Okay.
have a new chance to have an experience with preparation and integration. So I will tell
Yay.
you both my before meaning making or lack thereof stories, and then the one, and then the ones I have coming up that I'm very excited about. Ben, where can people find your work and learn more about you?
Yes. So um, I didn't actually mention this at the beginning. So how did I even get to here? Like, how did
Yeah,
we
you
end up
left
working
that part.
together? So yeah. Then when I transitioned out of community psych, I ended up working with Field Trip and Field Trip Health. If you haven't heard of them, they're a large network of office-based ketamine-assisted psychotherapy centers in the U.S. and in Canada, and even a psilocybin center in the Netherlands. And so I started one of their first clinics here in New York City, and still actually oversee some of those clinics. So if you're in New York or you're in DC and you decide to do ketamine assisted psychotherapy at Field Trip, then you'll be under my supervision in part. Uh, but most of my time these days is actually spent on the topic of increasing access and then mission. I have a personal mission to making ketamine more affordable and still keeping it safe, and also making it accessible, even just in terms of distance, because not everybody can be near a center that actually offers this. So I am the medical director with you, Lynn Marie. I'm on the medical group side, overseeing the medical providers of New Life, and New Life is a home-based ketamine service that provides both integration therapy and group context. We're eventually going to have individual integration therapy as well. And we also have health coaches because another part that I didn't get to touch on is the importance of integrative um, medicine. And that we need to take a bigger step back and look at the whole picture of the whole person. And so that's what New Life is about, is saying, oh, it's not just about ketamine or a psychedelic experience. In fact, we're one of the only companies that's one of our goals is to not give you more ketamine. Like we hope that eventually we'll get you to a point where you can find all of the tools in your life, diet, exercise, the topics we discussed today, like spirituality, community, to really engage all of these whole parts of who we are, and to bring that into our life as the source of wellness. That isn't to say that we couldn't do more exploration with ketamine if we needed to, but that's really our intention. And so, for those of you who are interested in that, you can go to new.life, new spelled NUE, and we have a couple different programs there, including our new app, or a new component of our app called New Care, which really covers all the bases of integrative medicine that I just spoke about. And also for providers on this call, when I think of increasing access, I really mean it. I want for other providers, we want here for other providers to be able to actually be able to utilize these tools and offer them to their patients safely, effectively, and feel like they have support while they're doing it. And so for those providers who are interested in that, you can go to newandue.network and find out more about how to become a partner with us if you are a prescriber or whatnot. Oh, lastly, could I announce our study?
You can do all the things.
Yes. So we actually we're about to publish a study on our findings. So for people that don't know, we've treated over 5,000 patients at this point, and so that's around 40,000 or more independent experiences now. So we have a really good data set now. We have a sense of the safety, of the efficacy. And so we started to release some of this data, and we're going to have our first paper out in Frontiers in Psychiatry, hopefully in the next week. So keep an eye out about that.
We will put it in the show notes whenever it comes out.
Awesome.
Ben, thank you for that summary. And I also, sending a virtual hug. We've never met in person. I just realized. But wait. I love that your heart is in access, which is obviously near and dear to myself. And this is why we're such pals. Thank you again for coming on and for sharing. And of course, this is just part one of Insert Denominator. We will do a number of podcasts because I think we've got a number of things to talk about. Amazing. Thank you so much for coming on the show and sharing with us today, Ben.
All right. Thank you, Lynn Marie. It was a pleasure being here.
Absolutely. All right. For everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.